Hello, my name's Nick the Nurse. Today we're going to be talking about the phases of the therapeutic nurse-patient relationship. Of course, you know, as the astute nursing student that you are, that the four phases of the therapeutic nurse-patient relationship, or partnership as some books describe it, include what? The pre-orientation phase, the orientation phase, the working phase, and the termination phase. In this particular video, we're going to be talking about the orientation phase. Now, for those of you who have had jobs before, those of us who aren't, most of us who are, I guess, lucky or unlucky, anyway, who have had jobs before, we get an orientation when we begin. And what is an orientation as it relates to a new job? It's when we learn new things. And basically, we're introduced to everybody. We're introduced to what's expected in our jobs, what's expected, or what the layout of the land is, what the facilities are like. And when you're having an orientation phase with a new patient, it's actually really no different. It's just really transferred concepts here. During the orientation phase, it's our first opportunity to meet the patient. But more importantly, it's the first opportunity to develop what with the patient? To develop trust. It's very important during the orientation phase that we use therapeutic nurse communication techniques to develop trust. What are some examples of therapeutic nurse communication techniques? Well, here's one. Did you hear it? Let me do it again. That's right, it's silence. Sometimes silence is a very important thing when it comes to using a therapeutic nurse communication technique. It shows that you're listening, shows that you're actually being engaged with what the patient's saying. Another thing that you can use is what? You can be reflective. You can rephrase what the patient said. So with rephrasing, you might repeat what they just said in kind of similar terms to let them know that you're actually listening to them. And that also develops trust. Other things that you can use to develop trust when you're dealing with your patient for the first time are to be consistent. If you say that your meeting is with the patient's going to be at 10 a.m., you better be there at 10 a.m. or maybe even a few minutes early. You also want to provide structure. Structure is something that's very important to develop trust with your patient. And once you get trust, you better do what? You better not lose that trust. So always be consistent. Try to be open and honest with your patient. And remember all of these things both for your nursing school exams, for the NCLEX, and for your practice as a nurse. I wish you the best of luck, and we'll talk to you soon.